focus on maternal health care. The idea is to train the journalists to know how to better report on maternal health, how to better discuss the issues so that it will have the needed impact. We are doing this because we think we are not doing well in terms of issues concerning maternal health care. We need to speed up on that, particularly in relation to the target that we set for ourselves as a country and as a world. So that is the focus. It's going to be a 2-day, full-day training just on maternal health care so that we can give them as much information as possible and, more importantly, teach them how to use information in their work as journalists, because sometimes you have the challenge you're confronted with a lot of data, a lot of figures, sometimes very verbose words, big words, and then the temptation is to rebroadcast or print those same words back to the public. When you do that, you don't educate a lot of people. So the idea is to, again, train them how to, when you encounter such challenges, how do you go around it? How do you break down the big words? How do you work with the figures so that they will make a lot more impact on your listeners or readers?
Okay. But do you see that it's very important in this regard when it comes to maternal health care or maternal health reportage? Somebody will say, are journalists also important at all in health delivery issues?
Yes, in fact, we are all involved. Everybody has a role to play when it comes to maternal health because we're all born. So it affects everybody. And more importantly for journalists, yes, because you have the access to the mass media. Okay. You write and the whole world reads. You speak and the whole world hears you. So if we get journalists involved in this crusade, we think we will achieve a lot. And if it is done very well, the impact will be very effective and it will be very wide. I mean, if you go to a hospital or if you have a midwife, go to a church or somewhere to go and speak, it's just those people within that enclosed area that will get to hear. But when it's on Kekeli, a lot of people listen. So the message goes very far. And so that's why we want our journalists to get involved, to understand the issues and to report on them and discuss them effectively.
Well, let me get to Eddie. Looking at the journalists, what they've been doing so far on maternal health reportage.
When you take out the list of the regions that record the highest number of maternal mortality, after the 2 upper regions, Volta region comes next. And even when you look at the population rate, I would even say Volta region is number 1, but because they are using percentage-wise, that is why it looks they are ahead. But it doesn't look good for the Volta region at all. That's why we want the journalists to further spread the message across and let the whole world know how important this is. And one quick note, this is just the first in series of trainings. So we are having only 13 journalists this time round. Hopefully, we'll expand the scope and get more journalists involved.
Thank you very much, Eddie. I will still get back to you.
I don't know talking now for Sierra. Fima kumia kwa basana. Ta mia na wo garema alo mio mi garema. Ama shama seni ama taganto seni. Ta eleve viena mi bere no peremiang. Alaba amaro vasere gba omonya bane yo fufu alaba yo fa koju. O gayi nare onto no rokyoshi na yeka deja gbona ko onto gajini. I don't know if of Kukulmo, Ika wana recommend afio no duji, ava koji, avoye do ye kakava rokoji a okuku, ta miagbo kova kunaro, ta anyana min tobere, nova, no garame, alaba education no di, and no di, kamijinaba no gna mononya, abana fufua, nubantola bana, when you balabana for koji, nava antenatal, what dopo, na wanarelia, what we know. No, do viji, a chico lio naga, na alemi wogano de via, ano toron de via kaba, na vube ya kulungo, mia chorango kaba, aha, no maore, ita mi ba no factor miang fisia, al agoniba MDG or Boloma, oba mi reduce maternal mortality, marakama gafo kochi of Vajifisiere, aku, mia reduce 3/5, that is 75%. By the year 2015, vo ma bloko ba asuso jinwade mia arofi matari o mia kwa nyaore o hia nto malaba marakana va agbena kweri abu agbo itemi be no va gere me plimi
Ebo la na ma leki mi dog penya jo dola shila shila ba nya jo dola mi na ka chu fi khayango o ho ko to ke ba ba vi na nyu ji leki mi atwa re mo ko mo no se ko ma ala mo nyu ko do pe mo
la porang ma bana mare va fia avumala la mana suru mi atayo bere nova no wo education na ma onya ba amashama ala ba nova kojia at least fu no re share asoro never re butu paraka ne nwie jona nya ba rova na fima na ba bumali ko ba me soro nyoro nya do gu samaritan komanya koshi ko o pli kwe yi wo nwara ne rurun kaka enwa omni kaka bloga bere manya yeto kaka na wo va o gare mo o renwo manwe a aha ne mi glomia kwa kuhio nori aro mia ori mi tenwa gomara gaba wasa manwe na mashama na nya bere ala vavie bere ya kpashiran ye sroin ya kpashiran community ya hari anyabo o afuno o bana fufu ko na va koji davi o hari akoji dama ta amashama asibere ala vavie bere ya kpere no vimu avukura ori barogbo gbroga ava duduhura avuoma na yetari ye mafuno kogo amaro obajiro 3 ya va klovu kakana miomye garamari onyaba o ala vavie ba ya kpere nyɔnu funɔ re sia re ŋu yakoe medzebe yabie gago hã yakoe kɔ akɔ yi ɖe kɔdzi dɔwɔlawo hã ɖe edu ƒuƒu na nɔ ŋu mi katã miakpa si ɖe mi hiã ɖe mia nɔnɔewo ŋmate mi be ne miakpe ɖe mia ŋu.
Mira apenas Innocentia Antonio makaiba ga bota ho ƒuƒu geɖe xɔ ga wu ama na xɔ nyitsɔ. End of year review. But apenas let me get to you, Freddie. Before I
today our journalists will reduce the NDC, MPP a bit, and then highlight more on our wives, our mothers, our aunties, our daughters, so that we reduce maternal. If every hospital in the region would get zero mortality like the whole municipal hospital, I think would have reached somewhere. So that is why we are training the journalists. Of course, as I said, it is just the beginning, and we hope, with your help and everybody's help, we'll achieve the MDG 5.
Thank you so much, Eddie. I envy you for that, because health reporter is one of the important areas that we need to focus on. Leaving aside the MPP and NDC, which is too much for our people. Freddie, your final words before I let go of you.
Okay, thank you. Again, what we want to encourage those who are fortunate to be part of this training program is that when they finish, let us put into practice whatever we study. And it's important when you're communicating that you use language that everybody will understand. And when you have figures, you use it in the way that everybody will understand. For instance, let me give a typical example. If you say that, if you're talking about an issue, then you mention that, there were maybe 40,000 people. If you say 40,000 people, not everybody can appreciate the figure. But if you use an example, explaining, it's about one stadium full of the crowd. That gives you a better picture than just mentioning the figure. So these are some of the things we're going to train our journalists on, so we can report better and